6 hours and decreased again to 0.5 mg per minute for 18 hours. And basically that's to give a load of about a gram. And so if you see those changes, we actually have an order set for that. And so usually when that's ordered via the order set, 3 orders will pop up, one for that first dose, one for the second rate, and then the third rate. So if you see that, that's kind of why there's 3 different orders that are entered. Some side effects that are common with this, because amiodarone contains an iodine moiety, it can have effects on the thyroid, and it can cause hypo or hyperthyroid. And so if you see teens ordering TSH levels or free thyroxine levels, that is probably what they're looking for. This also can cause pulmonary and hepatic toxicity. There are a lot of toxicities associated with amiodarone, unfortunately. But those are some that we tend to see. And then also ophthalmic side effects, so corneal deposits. And patients who are on this long term really need to have like baseline eye exams. It can cause photosensitivity as well, and you may have heard sometimes amiodarone can cause a bluish tinge to the skin. And paresthesias as well. The maximum recommended concentration for amiodarone is 2 milligrams per milliliter, and all of our concentrations that we have that we'll send up to the floors are 1.5 mg per ml, so that's not something that you should have to worry about. Are there any questions about amiodarone?
If we could get the right filter stock in the ShareMed would be nice.
We do.
They only have, we do now?
Yeah,
We should have it.
We have
I think it's probably not
We only have the blue TPN
Put
filter.
a sign, amio requires a 0.22.
Oh, maybe.
Yeah,
Something
we
like
can
that,
definitely
or-
make
Yeah.
that.
Because it's in there.
It's like right at eye level.
Oh, you push filter, and the only one I don't give you is the blue TPN filter, which is the higher
Maybe
micron.
under
But
tubing.
it's okay. She says it's in there somewhere. I'll
It
just have to
is.
find it
Yeah.
where to.
So the
Instead of
0.22
filter.
micron, yeah.
Okay.
And we can go take a look afterwards as well.
Okay. Thanks.
Yeah. So dronedarone is another agent that is utilized. This is only available as an oral agent. It does not have the iodine moiety, so it doesn't have thyroid effects like amiodarone does. It's much better tolerated because it has less side effects overall. But it is oral and it's given twice a day, and it's 400 milligram tablets, and they do need to be given with food. And the reason is because it has poor bioavailability to begin with, but when it's not given with food, the bioavailability decreases by more than double, and so, or more than half. And so it's really important to give that with meals. When this medication was compared to amiodarone, one of the studies showed that it wasn't as effective as amiodarone, and it's not really preferred in patients who have severe heart failure. So we won't really see that used in patients who have severe heart failure or in patients who have permanent AFib, so not paroxysmal, where it's less than 7 days, but permanent. This can also cause hepatotoxicity, so LFTs are something that will likely be monitored in patients who are on this medication. And then renal failure as well, so again, renal function, so BMPs are something that we'll see. And it is a pregnancy category X medication. Any questions about dronedarone?
Is it well fed?
Yes, that is well.